Okay, we're going to go ahead and get started. Thank you all for coming to our SHAC meeting, our School Health Advisory Council meeting. And we have a couple of ladies here that are going to give us some information. But right now I wanted to let Gabrielle Mitchell and Christy Williamson tell us about Tri-Lakes Pregnancy Center.
Hello everybody, my name is Gabrielle and we are, the Tri-Lakes Pregnancy Center has been around for a while, but we have just been revamping our resources over the last couple of months, and we are going to open our doors and have open hours starting in January. So we have free pregnancy tests that we offer. So even if a student or you hear of anyone say, oh, I might be pregnant, I think I might, they can come to us and it's all free for them. If they are pregnant, then we schedule a sonogram. They get a free sonogram to ensure that they're safe, first of all. We want to, when they come into our doors, we want to just squash the feeling that they're alone in this. And we want to be there first and foremost to walk by them in every way we can to get them the help that they need. So Christy Williamson is our RN, and she is certified now to do sonos. So she and I will be there during our open hours, and we are so excited. I mean, we've got other training. We've got training programs they can do. We've got a resource center that they do their training programs. They can earn baby bucks and then spend them in the resource center with diapers, formula, strollers, all different kinds of clothes, tons of stuff. So if you have any questions or if you want any pamphlets or anything for your students, or if you need some in your office or whatever, we've got plenty we can share with you. So,
Where are you located?
Sorry, we are located right now. We are off of the square. It's where the hub is. It's 203 Taylor Street. But people always get lost because we don't have a sign right now because we're in a county building. So we're working on getting a temporary sign. We're trying to find a different location. So we're doing a big fundraiser in March 23rd. You're welcome to buy a ticket. We're going to have a gala here in Mount Vernon to raise funds to try and get into a new location. We're trying to find that. So.
What kind of hours? Right now it's going to be 3 days a week.
Yes.
We're still trying to figure it out for sure. It's looking like probably like 8 to 4:30-ish. Is that?
We're going to have a late day, so we don't know exactly what day that's going to be. We will have a day a week that's later. And we have a medical director. His name's Dr. Dowdy. He is out of Sulphur Springs. We're having a meeting with him on Wednesday, and we're going to talk with him about if there is a student that needs to come get a sonogram during school hours, like getting that excused as a medical procedure, so that she can come and have the freedom to do that.
And Gabby and I are both really flexible, so if there's
Yes.
ever like someone that needs a sono for the meeting after hours when we're not available, I can always do it by appointment too. And get parents if they need to. And the pregnancy test is really important because getting that for free, they can go ahead and get started with like women's health Medicaid if they need it. So going ahead and coming to us to get that really helps them getting started with their prenatal care.
So yeah, and I can give you my number too after this if anyone wants my number. And we've got pamphlet there right here for the center. So, all right, thank you so much.
And next we have Martha Baker, and she's a retired nurse from Dangerfield, and she's very involved in the SHAC with Dangerfield, so she's going to share some information with us.
So the SHAC, I've been around since before it and when it started. And it originally, I think you'd be interested to know, it was originally designed so that it would decide what sex ed would be taught in the schools. Remember that? Well, then the legislator kept looking at it and they thought, this would be a great a place to accomplish a lot and include parents. And the reason I want the parents to know this is the place, and did you give out the one that was talking about why parents should be involved in the shack? So you probably found that. And so share that with other parents. I would be interested to know in this room how many are parents that don't work for the district. Yeah, see, that's where it calls it. And I can tell you, as someone who's been working at it for many, many years, we run into that same thing. Parents don't see the importance. But I'm going to tell you, in our day and age, if we don't get involved as parents, there's a lot of things being shoved down the pike, being taught to our kids that you don't want to happen whether you work for the school or not. But the requirement is you have to meet 4 times a year, and you have to have at least half of your people be parents. So you're saying, okay, well, we do good to get 1 or 2 there. I'm sorry, I keep moving around. But we've got to be creative. Now, when we meet, because we want our coordinated school health team, which is the school employees, to be involved, we meet at noon. And you say, well, you're not going to get parents. And I said, I understand that, but we now record the meetings as do y'all, and it'll be available to parents to watch. And so we can send things out to let parents know this is a good advocacy. If the school is adopting a new curriculum, health curriculum, parents should be involved. And you will have more of a vested interest as a parent to look at that material than the school is. The school's kind of told, you know, this is what you need to do, and then they've got a lot of things coming out. But let's look at this. How many of you have ever been involved in the shack as such? So some of you are aware, but you see the 8 components of school health. And it's so tiny, you can't read it right now, but nowhere in that does it say the nurse is in charge. And I would guarantee you in nearly every district that I work with, first thing they say, school health, it's the nurse. Well, I can tell you that's not necessarily the best place to put the load on. You always have to have administrators involved because that's who works with your curriculums and who also carries out what needs to be brought to the school board, things like that. So it lists all of it, and it'll tell you, if I can blow this up, I'm not familiar with Apple, the different components of school health, and we'll talk about that. But when they did SHAC, the Texas School Health Program envisions Texas where all children are healthy and ready to learn and prepared to make healthier life choices. Our mission is to support education, public health partnerships, and impacting school health issues in the whole school, whole community, whole child. And that came out several years ago and really was emphasized why to do that. So I want to show you a little video, see if I can find it. Oh no, let me go back. Okay. This is something that you can share if you're having PTA meetings or any parent meetings. This is how you get your parents involved. So why is SHAC in action so important? And it was developed by these agencies. And I mentioned today I went by AgriLife. And a lot of people don't realize how important, do y'all have AgriLife here? They have a lot of nutrition and wellness programs. They have just so many things that can offer. And they can come in and do demonstrations, and you see Department of State Health Services, and there's 2 in the room with us that, so there's a lot of partnerships comes together for a SHAC to work well. So this gives you the definition again. It's mandated by law. It's required, it's appointed by the school board. Has to be over 50% parents. It gives the parents a voice. And when I hear parents in the community complaining about the school, I say, are you part of the SHAC? What's that? I said, that's where you get your voice, is to become a part of the SHAC. And then It reviews all health-related curriculums and makes recommendations on health-related topics. I'm trying to go down. Anybody good with the Mac? Can't get it to scroll down. Slideshow, but I'm not sure when I get there, really. I don't want it to scroll with that. Oh, of course. So this tells you who can become members of the SHAC, and the 10 components of school health that we're going to go over a little bit. There needs to be someone at the school that represents that, such as PE, the food service, nurse, counselors, and like I said, the parents, but it lists who all can be a part of it. And that's important too. The benefits of it. A lot of people say, well, why do we have to do it? Well, it makes connections between health, academics, and the whole child's education. Emphasizes the health of the school community. It really brings support because as what I do grows, I've got pages and pages of resources now that comes and says, what can we do for your school? So, I gave you an evaluation form for the TSHAC. Do you see that? The state of Texas and the own Department of State Health Services developed a TSHAC, and that's a state-run group that kind of guides this thing. And I just want you to look over those things so that you know and can kind of decide, what do I know about our SHAC? And are we where we need to be? And I'm sure Tracy would love to have some input from you as to where you think you are. And if I were doing this just the whole meeting, I would suggest that you discuss this in groups. But take some time to do that and maybe let Tracy know what you don't understand or what you need questions on. Well, the last few years they've added and added and added what has to be done, such as cyberbullying and opioid abuse and the inhalers and all the inhalants that are important. And all of this can be addressed in your SHAC meetings. They recommend the number of hours you're going to spend teaching health. Now, the neatest thing that I was able to be involved in, I had a curriculum director one time, and she had all the teachers identify where this subject matter was taught. So say you were third grade, you were doing health TEKS. A lot of teachers, when I would go in and sit down and say, when do you teach health? Well, we don't teach health. I teach English. No. Somewhere in this grade, someone is teaching health, and where is it? And I think that's so important to identify where it's being done and whose responsibility it is to teach that health curriculum. Okay, so as you see, that's the whole school, whole child. So this would be a real easy thing to have at any parent activity, or when you register the kids for school, have a table set up for your SHAC. How do I get involved in this? And you really want to be involved in it because it will raise the level of awareness for you. I taught at Region 7 a few weeks ago, and they sent, it was a SHAC 101. The only one from their district that came was a parent that had never been to a SHAC meeting. And she was just, oh my goodness. And I said, well, you need to go back and say, okay, who actually is on the coordinated school health team and identify those. Tracy's trying to watch my time for me, so now that's all. Some of my things disappeared. Okay. So I created a document over about 20 years now of all the laws that affect school health. And it would just really amaze you when you look through. And I identified whose role it is to accomplish that, and Tracy will have this document. I don't know who your administrators are. But I would encourage you to go through and identify in the document, and I'm gonna try to go down to SHAC. The yellows you see is all the new laws that affects counseling and coordinated counseling that you have to have, alcohol and drugs. So just, you can see a lot has been added to responsibilities of districts. I'm so used to a mouse, y'all. Now we've had all the school safety things that we've had to add because of the school shootings, and it is addressed in here. How much mental health has been built in? Okay, here's the SHAC. So, does your SHAC have a mission, vision statement? Do you know if y'all have one?
We do, it's been a long time.
Okay, well, I have a template that I can share with you. And then also you have to develop bylaws, and I have a template for that. And I know how busy it is. And so I'm willing to share with your school just the basic stuff, and you can go in and change from Danesville ISD and put Mount Vernon ISD, as long as when someone asks you about the document, you're really doing it.
Mm-hmm.
So the new things that have been added is recording your meetings, and you have to post the meeting. I was so impressed when I looked up Mount Vernon. I was trying to find out where this building was, and it came up with the SHAC and what we're going to talk about today. That was wonderful, because I really think if we ever get audited on things, it's going to get to the point where they could just look online, just randomly say, let me see if I can find their stuff. The other thing is that 72 hours ahead of time, it has to be posted for parents to know about. And then has to have the time and the place, and then the minutes and notes have to be done, and you have to have a recording on it, and it has to be up within 10 days of the meeting. So, and that's quite a task, but what I do that might help you is when I have speakers come in, they give me their notes, and they give me their handouts. And so I don't misquote them, and it's something that parents can look at and learn from. So that's not as difficult. And you have to do a report to the school board at the end of the year to tell them what you've done, and I'll talk a little bit about that. So anyway, this document covers a lot of information. I'm going to go back to, see if I can find. Does it hide it after I look at it? I don't. I don't know how to go back to it. There it is. And like I said, I'm covering lots of material in 15 minutes, so. But this is something important for you to know about. They have a new guide that came out in 22, and I've shared this with Tracy on this flash drive. And when you go down, I even did your homework for you. I highlighted the things that are new and that y'all want to take advantage of looking at. But see, just the topics: tobacco use, unhealthy eating, inadequate physical exercise, alcohol and drugs, sexual behavior, sexually transmitted diseases, pregnancy, violence. There's a lot of stuff that now is expected to go through school health. So she will have this document, and I would suggest that your administrators and whoever your SHAC chair, the chairman of the SHAC is supposed to be a parent. And the reason they want that is it's easier for them to be noticing things that maybe the school didn't notice in there. Find her here. I'll have this down before I leave. So in 2008, we decided that one of the things the SHAC was going to do is look at violence. Now, we didn't know what violence was, did we? And so we got together, we had 85 people for a luncheon, and we brought in CPS, DSHS, just all kinds of agencies to talk about what we can do to partner and learn more to help our communities. And then every year I do, and I don't know if you'll be able to see that. Let me see if I can zoom.
Bottom right corner.
I see it.
There you go.
Go hit the plus on it. Okay, so the first thing I would do is try to develop a calendar, and I would ask my parents, what are some of the things that you would be interested in knowing more about, and pick something that you could do this year. The first meeting, you could be talking about where are we on our shack? Have we accomplished the things that we need to? And so that form that I gave you to evaluate can do that. But basically we went out, and I do based on what is the topic of the month, like suicide prevention we do in September when it's Suicide Prevention Week, and everything we do, it emphasizes emotional health and suicide prevention. And then in October, we do underage drinking, and we have agencies that teach. In fact, you were curious about who does the drug and alcohol prevention, and I'm going to help you find some resources for y'all's area on that. And so we have them come in and talk about, and a lot of these places provides the curriculum at no charge. And so another thing we learned in September, let me go back, it caught my attention, is UT is really pumping out a lot of counseling. And they know how hard the mental health is and how hard it is to get what people need. And they developed something called T-Chat. And it's Texas Health for Children. And if you had a child that was struggling, the parents didn't have insurance and they need counseling, they actually will get online with you, and they can work through the school to help access what they need on that. Then, of course, Red Ribbon Week, most people do in prevention. Let's scroll down as quick as I like. And then November is Diabetes Awareness Month, so that would be a good emphasis to put information out for your staff. And then January we do human trafficking, and we have 211 Can Help Online is y'all's, and they come and they give us a summary of what our county needs were. And I think that would be beneficial anywhere you were. And then, are y'all familiar with PATH at Region 8? They work with children who have autism or learning problems and all, and they help. They do webinars and seminars for parents. And then in March, we're going to have wellness and nutrition. And I'll ask the cafeteria if they'll make something different than the kids are used to. Just try to introduce a new food item or offer something special for the staff. You also will find there's agencies that will come and sponsor a staff luncheon where they can teach about nutrition and wellness. And then April, we do child abuse prevention. I mean, we do more than is required for the shack. And if that's not your biggest need here in Mount Vernon, what is? Have you had kids that are overdosing? Seems like I've heard that there's no problem. Seems like I've heard that there's been some issues with that. Or if you have a lot of teens getting DUIs, find out what your community's needs are with your kids and start talking about what do we want to meet on, because I don't believe in just meeting to meet. That's not good. How am I doing on my time, Tracy?
5 minutes.
Okay, perfect. So I'm going to go back one more thing. I'm at the shack. I want to review. Okay, here's your 10 components of school health. So health education. So your coordinated school health team should have your health teachers on it, and they need to be a part of the discussion. And I usually will have a meeting at the beginning of the year and let them tell what's new. You know, we're teaching a new curriculum, or we have added minutes that's required for the kids, or we're adding whatever. And I give each of these groups an opportunity to tell me what's new or different in their area. And that enlightens parents on what's going on. So, anyway, it's a lot. I realize I'm just touching the tip of the water. I'm available because I really believe in this. I've seen such improvement. And I'll just give another little scenario. Because of what we were doing with Ounce of Prevention SHAC, we got a grant from the Hog Foundation in Martin County. It was a $400,000 grant. Just to ask, what do you think you need? At the end of the 3 years, they said, we're so excited what you're doing, we're going to give you 5 more years. So SHAC is important, and it can make all the difference in a community. Any questions?
Will you tell us about when y'all meet and stuff and that other shack committees
Yes.
come and all of that?
I hated COVID. It did so much damage, but it also provided technology we didn't know we could use. And when we first started doing Zoom meetings, it wasn't helpful. But our meetings are provided online, and you just log in, and you can hear what we say. And then also, I send out the minutes, and you can click the link, say, I was working that day. Click the link, you can watch the meeting, hear what the person said. And I think that's great to be available for parents to watch at their convenience. Or maybe, did you really say that? Then you can go back and do that. So we meet the second Tuesday of every month except when spring break comes and we have to avoid the conflict. So you'd be welcome to tune in. The other thing that I offer, Tracy, is if you wanted to, like you had a topic you're going to cover, and we've covered that, you could play that portion of it for your SHAC meeting so that your parents could hear that. So you have to be creative these days. Anything else that, I realize you're thinking on mine, but really involve your parents. If you hook something that they are comfortable with, that they want to be a part of, they'll really feel valued at doing that. Anything else? All right, I've given you a taste, and y'all know where to come to shop.
Thank you, Mark.
Next, we have Anna, Rundle, and Rusty Bag. And they're from the Department of State Health Services, and they're going to tell us a little bit about some medical programs.
You don't have to stand up right now.
Hi, my name is Anna Rundle. I am a social worker with the Department of State Health Services. I help children and adults. We don't provide direct services how you would typically think a social worker or a therapist would. We broker services, so if your kid needs a new wheelchair, they don't have insurance, we broker those services within the community to help the parents also see what they need. I'm sorry. So this is one of the programs that we offer. These are for kids 21 and under who have a physical diagnosis. It is an insurance program, how you think something like Blue Cross would work. This is what this is. And then these two are attendant care services. These are behavioral and physical diagnoses. If your kid has ADHD, disruptive mood disorder, there are things like this where an attendant can come in and provide those services. We would just have to do an assessment. I cover the Titus, Franklin, Morris, and Kent counties, and then if they are Spanish speaking, my cohort Justina would see them if their primary language is Spanish.
Okay, that was quick.
Okay.
Oh, no questions?
I'm sorry.
I do have one. Is there any kind of criteria that they have to meet to qualify for these services?
So for the case management, our policies kind of changed with the legislative decisions that were recently made. They can't have things like managed care organizations. For the attendant care services, the ones that we do manage are the Superior and Amerigroup. But if they have something like Texas Children's, I can refer them to their service coordinator and they could do it for them.
Okay, well, I am with the Department of State Health Services also. I do immunizations. I recently was kind of thrown into TB. So I'm learning a lot about TB. And you'll be surprised how much TB is in our area. There is a lot, with a lot of the illegal immigrants coming over. The U4, which is the Ukrainians, they have a parole coming in that the United States has letting them come over on parole without any kind of criminal activity, then they can work to get their citizenship. We, as the immunization, will immunize them with polio and other immunizations, which would be free to them because they are immigrants. So, but that being said, I have babies. This is up to 18. It has the what they all need for each age group. It's magnetic, so you can hand these out or whatever. I brought quite a few of them. This is statistics on the flu. The flu, with our flu shots being given, I try to promote it as much as possible. The flu season is peak in February, but getting the flu vaccine reduces it and has reduced it for like 50% over the years, okay? Also, it's important for the adults to get vaccines. This is for adults that was born in 1957 to before. They are in need of pneumonia vaccines, Tdaps, which is the tetanus vaccine with pertussis. Pertussis that is still out there. We have had more polio lately, so it's not eradicated. So y'all just be aware of that adults need it also. And I noticed that you also said that you were going to have like a event. We actually provide a nursing booth. It's like a little tent, a nursing tent that the state will provide you. And we'll just come out and clean it, make sure it's clean, and it has handy wipes, it has a trash basket, it has, just for the mom to be able to sit and nurse her baby in privacy. Okay? All right, that's all I got.
Very good.
Last on our agenda is we're trying to develop a Narcan policy for overdose of opiates. And Dr. Latortu is willing to write the prescription and be the medical advisor for Narcan and epinephrine, unassigned epinephrine pens. So I'm working on those policies and trying to get that in play. I'm having a little bit of difficulty getting a distributor for Narcan, so I'm working on that. I've got some requests out to some companies, and also with the EpiPens, I have submitted a request for that. So whenever we get the medication, we're going to start a training program for staff, and that'll be an annual training. We'll keep a log of the people that are trained on each campus, and then the nurses will make sure the medications are within date. And anyway, it'll be a process, but I feel like it'll be something good for us to have for students' health safety.
There was, in Dangerfield, at the Morris County event, there was a lady that had little packets that she provided to
And
schools.
it came from his clinic. You should ask him because they
Yes.
provide it free.
That was Beverly that came.
Yeah.
Was it Beverly? So,
That had
Yeah, Franklin
drugs in
County
it?
is the one that's providing all of ours. All we have to do is set through the training, and then they give us the kit and everything.
yeah.
He writes the order and gives the kit.
I I have the order from him, but they
Okay.
didn't offer a kit, so.
Well, say, we heard that y'all did this.
Okay, because I've called,
Because
Walgreens.
definitely I think he'd want to here.
Yeah, I called Walgreens and spoke to the pharmacist there about Narcan, and she was telling me that they're a retail provider, not a distributor. So
Mhm.
she said based on pharmacy laws, they could not fill it for a school. They could fill a prescription or whatever for an individual.
Right.
So I'm looking into it, but I'll have to get with you about that.
Yeah.
Any questions on Narcan or epinephrine? The Narcan, I believe, will be for the high school campus, and then Epi will have that on each campus. And that's for anaphylactic reactions. Any questions? All right. Anybody have anything else they want to bring up or talk about? That was the last thing on our agenda.
I would love for them to write something down for you that they would like the SHAC to discuss this year.
Okay. If y'all will.
If y'all write something, and pass it up to her that this is a topic I think our SHAC should address this year. It'll give her something to go on,
That sounds
and
good.
you got feedback from the group.
Thank you. Anything else?
I'm done.
Thank y'all all for coming. I appreciate it.